We want to make sure you have that. And if you have any topics that you would like to see in the future, be sure to email us and let us know, because really these are workshops for you, and we want to make sure that we're providing you with something that is very useful. And after that, I'd like to introduce Dr. Douglas Gordon.
Good afternoon, everyone. Thank you, Kate. Appreciate the intro. I'm happy to be here. Happy to do this again. I did a presentation a few months ago in the summer that went over really well. And one of the things we touched on during that presentation was sleep. And I mentioned how sleep was just so critical to health, and that really should be a presentation in and of itself. And lo and behold, 3 months later, we're doing this. So happy to be here. Quick little couple housekeeping for me as well. For those of you who are calling in, I do have some slides on this presentation that show some graphs. So that's probably not going to make a lot of sense to you, but I'll do my best to try to explain that. But like Kate said, for everyone to have this presentation later where they can go back and review it, I think that'd be super helpful, because I really packed a lot into this, into these next 30 so slides, and probably more than you can actually absorb in 1 hour, but that's okay, because I want to just give you what I can on sleep. There's been so much more research on sleep in the last 10 years. We're so much more knowledgeable on the importance of it, and it's just how critical it is. So use this as a resource. I will be keeping an eye on the chat, so if you have a question, feel free to shoot that into the chat. If I will try to address the question. I might just say, hey, I'm going to get to it later, because there's a lot of stuff that we'll try to cover throughout the presentation. And I'm hopeful to have this done by 1:40, 1:45, so that I can answer more questions as we go along. So I'm going to move as quickly as I can without getting too fast, but away we are. So let's talk about sleep, folks, and why it's so important. Let's start with some numbers. One other final housekeeping thing I forgot to mention. There are going to be 4 key takeaways from this presentation, and the takeaways are not on the have a pen ready, have your phone ready to jot down a couple notes. Let's talk about the numbers. 70 million U.S. adults know disorder, and snoring is 40% that they follow in a day, every month. 5% report that nodding off or they fall once a month. Obviously, drowsy, 1,500 days, and insomnia, most common disorders, with term issues reported by about 30% of adults, about 10% of adults. 25 million adults who have some sort of obstructive sleep apnea. Anywhere from 9 to 20% of women have that, and about 24 to 31% of men have that. And again, that's just a diagnosed, so it means they've actually gone to a doctor. I think there are probably a lot of adults that have non-diagnosed sleep apnea, so those numbers might be a little higher. About 3 to 5% of the overall population of obesity in adults can be attributed to some sort of shorter sleep cycle as well. Let's see, 30 to 37% of 20 to 39-year-olds report some sort of short sleep duration. About 40% of 40 to 59-year-olds report short sleep duration. And we'll get into why that's important later and as we talk about the sleep cycle. But about a third or more of adults report that they get less than 7 hours of sleep on a typical 24-hour period, which is not sufficient. And we know more about sleep deprivation now in the hospitals and from hospital staff, and how medical errors can lead up to about 100,000 deaths every year in the U.S. hospitals. And a lot of those errors occur because the staff was sleep deprived. Let's talk about some health risk factors by sleep deprivation. So these adults who are short sleepers, meaning that they don't sleep any more than 7 hours every night, they're much more likely to report being obese, physically inactive, or current smokers compared to people who do not get enough sleep. This slide here is our first key takeaway. So there are 10 conditions listed on this slide. These are chronic health conditions and they're related in some way to sleep deprivation. So adults who were short sleepers, meaning they get less than 7 hours of sleep per night, they were more likely to report one or more of these 10 chronic health conditions compared to those who do get enough sleep, meaning they sleep 7 hours or more. And the health conditions include heart attack, coronary artery disease, stroke, asthma, COPD, cancer, arthritis, depression. I would probably throw anxiety in there as well, kidney disease, and diabetes. Now those 10 right there, those are the major health issues for the majority of people who have chronic disease in the United States. And it's a two-way street. If you have those conditions, your sleep is much more likely to be inhibited somehow. And if your sleep is inhibited, you're more likely to get those conditions. Now, the flip side of that is if you improve sleep, they have found that you're going to have a higher success rate of treating those 10 conditions. So that's our first key takeaway, is understanding that these 10 major health issues, heart attack, coronary artery disease, stroke, asthma, COPD, cancer, arthritis, depression, kidney disease, diabetes, they're all attributed in some way to the quality of our sleep. So what if you're still not convinced about all this? Well, don't worry, I got more for you. Skipping out on sleep is going to impact more than that. It's also going to impact our ability to think effectively, to react quickly, to create memories, and to regulate our emotions. So let's get into that a little more. Let's talk about the cost of sleep deprivation as it relates to longevity. So our likelihood of developing diseases and chronic ailments, including obesity, depression, diabetes, and cardiovascular disease, is much higher if we have sleep deprivation. With sleep deprivation, our sympathetic nervous system, our fight or flight nervous system, becomes overactive, meaning it's going to pump more cortisol into our system, and cortisol is a killer. Our body's primary healing resource, meaning the human growth hormone, dramatically reduces production during sleep deprivation. So if you have kids and your kids are not getting quality sleep, they're not going to be able to grow as much. Reproductive system is also disrupted with chronic sleep deprivation. So a man's testosterone levels decrease to the equivalent of a man who's 10 years older, and women have disrupted conception hormone cycles when they are sleep deprived. Moving on, how about energy and resilience? Well, when we are sleep deprived, we're more likely to have physical exhaustion. Our injury rate will increase. We're much more likely to get hurt when we're sleep deprived. Our tissue repair slows, and lactic acid builds up faster. And our peak muscle strength, vertical jump height, and running speed all decrease from sleep deprivation. This has all been proven in studies. If you follow competitive athletes, I'm going to use the NBA as an example. I'm a big NBA fan. You follow these athletes, and what these athletes do, these are some of the best athletes in the world, probably in the history of the world. They make sure they sleep, and they protect their sleep above all else because they know they're going to have more energy, more resiliency. They're going to heal after a game or a competition faster. They're going to be stronger, jump higher, run faster, etc. because they're sleeping more. Keep going on, more with sleep deprivation. What about with weight and metabolism? Our probability of gaining weight, being overweight, and or developing type 2 diabetes increases when we're sleep deprived. Our weight loss is going to shift to shedding valuable muscle rather than fat. Our likelihood of increasing, of overeating increases as our hunger hormone levels rise in the body. And our chance of having gastrointestinal problems and nutrition absorption, those issues all rise as increased cortisol levels. Again, cortisol is back in play. Cortisol levels cultivate bad bacteria in our gut. So sleep deprivation leads to more weight issues and a much slower, less healthy metabolism. About immune functioning? Well, we know if you don't sleep as much, you're a lot more likely to get sick in the short of it. Our immune system is disrupted, and it's handicapped at reducing inflammation. And without that immune response, we're much more likely to develop, or be susceptible to any bugs or viruses going around in the environment. certainly applicable to 2020. Effective thinking. If you are sleep deprived, your brain accumulates toxins that impair our behavior and judgment. Our short-term memory and attention are reduced, our ability to solve problems, be creative, and use divergent thinking declines, and your crucial decision-making center, which is called the prefrontal cortex, that shows reduced activity. So we're just not really that smart when we're not sleeping, which also speaks to students. You know, and the more students are pulling all-nighters studying for an exam, they're actually finding that that is not an effective strategy for learning long-term at all. Calculating the cost of sleep deprivation continue. We've got a couple more slides on this. Our reaction time is going to be significantly reduced. That it's going to be equivalent of being inebriated after 20 hours of being awake. That's what our cognitive impairment is going to be like. And our risk of being in a motor vehicle accident increases pretty significantly when we're sleep deprived as well. Memory formation, our brain's ability to learn and create long-term memories is compromised, and our regulation of emotion is decreased as well when we are sleep deprived. So our brain's emotional center, which is called the amygdala, it increases activity, and we are much more likely to overreact to social situations such as a fight with our spouse. And we've probably all been there. We've all been in, you know, had a really bad night's sleep, and then you get in an argument at work, or you're much more short with your family because you're just not, you didn't get the right sleep the past couple nights. So this is our second key takeaway. After all that, I think that's probably enough info for you to at least know that sleep is really, really, really important, and healthy sleep is really important just to be a healthy person. So to get through your life and to just kind of do daily activities, having a regular sleep pattern is important. So our first takeaway was the 10 major health conditions. The second takeaway is that sleep in general is a critical component just to being a healthy individual. So let's move on to what sleep actually is, and we'll get into some more of the nitty-gritty of what a sleep cycle is like, and how sleep is more complex than maybe we thought it was. So we're often told that sleep is a process that happens at the surface of the brain, so like a few millimeters measured by an EEG. But in reality, sleep occurs throughout your brain and your entire body. And that occurs thanks to a network of internal clocks that report back to our central sleep CEO. We'll call it the sleep CEO. The sleep CEO is a deep brain center that determines whether or not it's safe to take your systems offline for sleep. And your sleep CEO requires a lot of feedback from our body's network of clocks before the sleep CEO can make its final decision on whether or not to go to sleep. So we have a picture here. Now, for those of you on the phone who cannot see the slides, we're going to have a few slides coming up where there's some pictures, so I'll be referring to those. Don't go away though, because at the end of this presentation we get into more of the do's and don'ts of sleep, and if you have some sleep issues, and what you can do to help with it. So this picture here, we're going to be discussing. It's giving us some time-giving cues like the sun and our phone and temperature and hunger and activity, and then we have different timekeepers within the body as well. So we have a feedback system that consists of these timekeepers and cues. The cues can originate from our environment like sunlight, or from within the body like food entering the stomach. These cues motivate the clocks within our body to promote sleeping or to stay awake. So our clocks react to these cues and they communicate with one another throughout the day. This is an ongoing conversation. It's a dialogue. So the clocks are sending information like, hey, I'm hard at work, we got to stay awake, or hey, I'm ready to rest, let's start to power down here. Your head manager, or the primary clock, is the message relay center in the brain, and it's known as the suprachiasmatic nucleus, or the SCN. The job of the SCN is to keep all the clocks on this consistent schedule and compile the final daily report for the sleep CEO to review. And the SCN keeps time by taking cues from the light in the environment. If there's light outside or light in your bedroom, it will jump on in the intercom. It will announce, hey, it's daytime, let's go to work. And it's going to alert the rest of the clocks. If it's dark, it's going to deliver this announcement like, it's nighttime, hey, let's power down. And believe me, that right there, that's a big issue as it relates to patients that I know who are third shifters. You know, they work at the factories in a third shift. their nurses, their doctors, and not having a consistent night light and dark schedule really messes with that timekeeper quite a lot. So this creates this sleep cycle, and it's more like a wave, okay, where ideally the sleep CEO makes these clear decisions, and it has a defined pattern of sleep, where we're awake during the day and then we sleep at night. But of course that wave is much more complex than that. The sleep cycle isn't always that easy. Our CEO has to decipher inputs from all these secondary clocks before it can make a decision. Our SCN and the secondary clocks all have their own status reports, so when your clocks are all aligned, your SEO's job is simpler, and it results in these clear patterns of sleeping and waking up. So we got the light report, and we got our stomach is giving a report on when it had its last meal, and we got our adrenal system is delivering reports on stress from the day, and if all those reports line up, then the CEO can say, hey, let's go to sleep. But that doesn't always happen. So we get what we have here on the right with a misaligned, a malaligned sleep and wake cycle. So when the reports aren't aligned, the sleep CEO has a difficult time deciding whether or not you should be awake or asleep. For example, if you've ever lost a night's sleep due to stress, it's very likely your internal clocks were misaligned. So let's say your SCN and your stomach may have reported a clear pattern of sleeping and waking up. So your light exposure and your meals were all they were on track for the day. But you had a really stressful day, and it triggered this secondary clock in your adrenal system to send all these multiple signals saying, hey, wait, don't go to sleep, delay, we can't shut down yet. But now it's 11 o'clock and you're trying to go to sleep, but your adrenals are firing, so your sleep CEO has a really hard time making its final decision, and you can't go to sleep. So each night we take this roller coaster ride through different phases of sleep. Though you're unaware of what's going on, when you're sleeping, your brain and your body are in this active state. Each stage of sleep has distinct restorative qualities, and how you move through these phases plays a really important role in our body's status the next day and the day after that. This is part of what we've learned more in the last 10, 20 years on sleep, and just how these different phases are so important. So during an ideal night's sleep, you can go through several 90-minute cycles that sample each phase of sleep, and each cycle plays an essential role in maintaining our mental and physical health. The amount of each phase of sleep can vary significantly between nights and individuals, but we're going to get into those phases, those stages of sleep right now. So sleep has been traditionally divided into two categories, non-rapid eye movement or rapid eye movement, or REM. Both are exactly what they sound like. Your eyes either remain still or they move rapidly under our eyelids. Together, these two types of sleep make up a single cycle where our brain progresses sequentially through each stage of sleep. So we're awake, this is the stages. We're awake, we go into light sleep, then we have deep sleep, then we have REM, and then we repeat that, okay? So awake, light sleep, deep sleep, REM, and repeat. So stage one is we're awake, and during the awake time, it's totally natural, totally normal time to be awake. It's the time spent in bed before and after falling asleep. It also includes very brief awakenings throughout the night that we may not even remember. These episodes are completely normal and healthy for normal, healthy adults. Stages 1 and 2 include the light sleep. Now, light sleep initiates our body's sleep cycles as we transition to deeper sleep stages. During this stage, your muscles begin to relax. Your heart rate and breathing slow down, and you're more likely to wake up easier. During light sleep, you can expect the following things to happen. Your muscles relax, but they might jerk. Respiration rate slows. Our heart rate decreases, and our body temperature starts to drop, and sleep begins. Stages 3 and 4 of sleep include deep sleep. Now, deep sleep focuses on the body. It is the most rejuvenating and restorative sleep stage. It promotes muscle growth and repair as well as waste removal in the brain. In this stage, you have difficulty waking up, and you're going to be disoriented or groggy if you're awoken. And we've all been in that situation where we're in a deep sleep and we get woken up and we have no idea where we are or what's going on, and we're completely out of it. And that's because you were in a deep deep sleep when you are woken, as opposed to a light sleep. During deep sleep, you can expect the following things to happen. The blood pressure drops, blood flow increases to the muscles, our repair hormones, like our growth hormone, is released, tissue growth and cell repair occurs, and we have very long, slow brain waves, and the brain is flushing out all this waste in our body. Now, REM sleep, stage R. During REM sleep, it's essential to re-energizing our mind. REM is associated with dreaming, with memory consolidation, with learning, and with problem solving. The time spent in this sleep stage usually decreases with age, so we have less REM as we get older. But during REM sleep, we can expect the following. Our respiration will increase again, our heart rate might increase, the temperature regulation is usually switched off, so we may get a little warmer, we might get a little colder, and the brain activity is very high, and we have vivid dreams occurring. The body becomes immobile, and that happens so that we don't act out when we're dreaming. And then more blood will flow to our genitalias at the time. So if you have a full night's sleep, it looks something like this, where you go through all of these stages multiple times, where you're awake, you go into light, you go into deep, you get into REM, and then you might wake up, and you might go to light, and you might go to REM, and then you might go to deep. It kind of goes back and forth, and you're hopefully going to cycle through at least 5 or more times throughout an evening. Your body cycles through these stages 4 to 5 times each night. The cycles earlier in the night, they tend to have more non-REM sleep, while later stages have a higher proportion of REM sleep. By the final cycle, your body may even skip the non-REM sleep altogether. Overall, your body spends more time in non-REM phases of sleep than in the REM sleep. So we have here kind of a percentages of the average time spent in different stages. We're awake for anywhere from 2 to 5% of the night. This isn't a healthy sleep cycle, by the way. A light sleep might be anywhere from 45 to 55%, and our deep sleep might be from 13 to 23% of the night, and the REM sleep might be anywhere from 20 to 25%. So we might be dreaming and having REM sleep for almost a quarter of the night, whereas when you wake up, you feel like you just had a dream, and that may be the only dream you remember. You were probably doing that frequently throughout the whole sleep cycle. Okay. Before we get, now the next 3 or 4 slides, really where we're going to spend the rest of the presentation, is on some tips about sleeping, which I'm sure a lot of you are wondering about some tips. This is the third takeaway, though, from this presentation, is that everything we just went over with the sleep stages and the waves and the cycles, sleep is really complex. It is much more complex than we used to think. We used to think you fell asleep and you woke up and maybe your brain had some dreams and that's about it. But we know that sleep is much more complex and it needs to be treated as such. It's not a simple fix. Improving sleep is not simple because there's a lot of variances there. But once you understand how it's important to have a little bit of knowledge on our sleep, you don't need to have it, the knowledge that a PhD might, but just having appreciation for the different phases of sleep and the different waves, having appreciation for that complexity is going to help you sleep better, because then you can pay attention to the things that might improve some of those different aspects. So the first major takeaway, again, those 10 health conditions I talked about. The second takeaway is just how healthy sleep is really important to being a healthy person. The third key takeaway is sleep is very complex, and just having an appreciation for that complexity is good. So before I get to the other slides, which are going to talk more about some tips on sleep, any questions on those things, feel free to put them in the chat. I'd be happy to answer those as I get into this. I'm keeping an eye on the chat, but we're moving along at a pretty good rate. It's not even quite 1:30 yet, so we're doing pretty well so far. Hopefully I'm not going too fast for you, though. Okay, so let's talk about tips for improving our sleep, which, if you're an adult, more than likely, you've had times when you haven't slept that well, where sleep has been a challenge for you. Especially if you have any of those conditions we talked about earlier, where, let's say you're struggling with type 2 diabetes, you had some problems being overweight, maybe you have some bad arthritis or joint pain, your sleep is almost certainly going to be affected by that. So let's figure out some tools here that maybe you can start to take away to improve your sleep. So we know that all these stages of sleep are important, and our body naturally regulates the sleeps to get the kind of sleep you need. What I recommend is having some tool to monitor your sleep. If you have sleep concerns, if you have health issues that are really limiting some goals that you have, start looking into sleep, but have something objective that will help you actually measure your sleep cycles. And I have a picture of what's called the Oura Ring. And the Oura Ring is a comfortable wearable device that you wear on one of your ring fingers. It measures these sleep stages, and it generates what's called a sleep score plus a readiness score every day when you wake up. So I have an Oura Ring. I'm very partial to the Oura Ring. I love it. It's like the best advice. It's the best purchase I've made in the last 2 years. They're not terribly expensive, but it is an investment. The technology is really cool, and it measures everything that I talked about in those previous slides: your REM sleep, your deep sleep, your light sleep, the time you were awake. It measures activity through the day. So if you go for a run or you play a round of golf, it'll show how much activity you actually had, and it's a terrific way to look at the data on sleep and get a better idea about how ready you actually are. It measures body temperature when you're sleeping, heart rate variability, which I did not get into, but heart rate variability is a really important aspect of healthy sleep, and it's a really good indicator of overall health. Now, there's other tools out there. The Apple Watch has some sleep scores on there. I think the Fitbit does as well, and I think those are really good too. So if you have one of those, if you're partial to those, maybe you don't want to wear a ring. Personally, I don't want to wear a watch or anything on my wrist, so I like the ring, and I found it to be a great investment. So auraring.com, I think, is the website. I have no stake in that game, so get whatever you want, but I would recommend something. The reason that I'm saying to look at something like this first is, again, because you really, if you want to get better at sleep, you have to find some objective way of measuring it other than you wake up and you say, well, I think I feel good, or I don't think I feel good, I don't know if I slept well, or I did sleep well. You need something more objective, and that's what these tools will give you. So check that out for sure. The Oura Ring is just, I can't recommend it highly enough. Some other tips for improved sleep. We know for sure if you're getting daily exercise, preferably earlier in the day, so you're not exercising any later than mid-afternoon, like 3 or 4 in the afternoon, you're going to have better sleep. And that's pretty well proven. If you get strength training, cardio, yoga, whatever you like to do, the more active you are, if you have the right balance of activity, you will sleep better. Now, if you have too much activity, and this is something that I've learned wearing the Oura Ring, I get much worse sleep scores on the day when I've been overactive. So maybe I have a busy day at work, and I'm a chiropractor, so I'm adjusting patients all day, and I'm moving around. Maybe I also worked out that morning, and then I go home, and I've got a bunch of yard work to do, and I have a ton of activity throughout the day. Well, I have a worse sleep score that night because I actually tax my body too much. I put too much into my activity. So finding the right balance of daily activity is important. Now, if you have a desk job and you're more sedentary through the day, you got to find time to get up and move around, and that's a really important part of it, is getting the daily activity. Caffeine consumption, clearly it's a stimulant. You don't want to be drinking a lot of caffeine. If you have sleep issues, you have some other health issues, avoid the caffeine at least 8 hours before you want to go to bed. Avoiding big meals or big snacks close to bedtime. This is something that is really challenging for a lot of people. They're used to having the snacks at 8, 9 o'clock at night, but they will elevate the metabolism. Eating too close to bedtime increases our resting heart rate before bed, and it does harm your sleep, and it's best to avoid these carb-loaded meals 3 hours before bedtime. It gives our body more time to digest. And I wish I would have done this. I could have included some of the data from my ring on the days when I have a big snack at night, and my sleep is much less effective. And the ring will give me a score the next day that's less, and it'll even have little suggestions being like, maybe you ate too close to bedtime, and I'm like, I absolutely did. I know I should not have had that snack, or I might be out with my wife, and we have some late hors d'oeuvres or something like that, and sure enough, it does negatively affect the sleep. So something to be aware of is when we're eating food. I mentioned food before bedtime, and then I would say even more frequently used before bedtime is alcohol, right? While alcohol might make us relax, we might feel a little sleepy when we drink, certainly too much is going to rob us of highly valuable REM sleep. And once the alcohol wears off, you're much more likely to wake up throughout the night, and you are going to have much lighter overall sleep. Again, this is backed up by data. We know when people are using a device that measures their sleep and they have alcohol, their sleep is much less likely to get into REM sleep. You're much less likely to get into deep sleep where you regenerate and you heal, and you do wake up more frequently. I know for me, again, if I have that cocktail too late, it's gonna be a mess. So just drink during the day, right? That's all we gotta do. Maybe on the weekends, not during the week. I'm a big believer of mindfulness, doing some kind of meditative process. You could definitely do that later in the day. If it's something like yoga, make sure it's a very gentle, simple kind of yoga. Certainly, we have here, Stress Lesson Mindfulness Workshop Series begins September 18th. Oh, great. Okay, so something like a mindfulness exercise, mindfulness activity. There's really good mindfulness apps out there. Headspace, I believe, is the name of one of the apps that a lot of our patients are using. I have downloaded it. I've played with it a little bit, but I haven't got into using an app. But there's really nice research on just understanding how we breathe and how our body reacts to our breath, and practicing that for 5 or 10 minutes every day, especially close to bedtime, is going to help. Turn off your screens. You know, we're not meant to fall asleep with the TV on. We're not meant to have a screen on right before we go to sleep. Whenever you have that screen on, the TV's running, you've got noise going, you've been on Facebook at 11 o'clock at night, and then you put the phone down and you expect your body to get right into this sleep cycle. It's not going to work. It's not going to be an effective way to sleep. There's a concept called sleep hygiene, where you have a routine 30, 45 minutes before you go to bed. You're knocking off the screens. You crack open a book. You do some reading. Maybe you have some nice tea or something very light. You wash your face. You brush your teeth. You tuck your kids in bed. Whatever it is you're going to do, something that's very calming. And you get into that routine, and what you're doing is you're training your body to calm itself down. You're training those adrenals and the nervous system to relax, and having that routine before bedtime is really critical, and it does help with those sleep cycles as well. Here's a tough one as well, but it's proven to work. Wake up at the same time every day. People who have a hard time sleeping, they try to go to bed earlier. Like, well, I got to go to bed. I got to go to bed at 9. I got to go to bed at 10. Practice instead, like if you got to wake up by 6 a.m. every day for work, then do that every day, particularly on the weekends. You cannot make up that sleep, and that's been shown quite a lot, is you can't sleep more on Saturday and Sunday and bank some extra sleep that you lost throughout the week. That's not how it works. Our body's always trying to learn and train, and if you're getting up at 6 a.m. 5 days a week, and then you sleep till 10:30 the other 2 days, your body is going to be off. And a good number is about 90 minutes. You don't want to be waking up any differently than 90 minutes, more or less on the weekends or on a day when you normally don't. So if you have insomnia, if you have some sleep issues, set a time where you're going to wake up every day, regardless as to how well you slept, so that you train your body on how it's going to start the day, not how it ends, and then get into more of the sleep hygiene later. So I did not include sleep aids in this presentation, particularly I did not include things like melatonin. There's some herbal remedies, things like that. I like melatonin. I've used it myself. Melatonin is safe, and it is a nice way to improve some of those sleep cycles. I know for some people, and for me in particular, you take melatonin, you're going to have better REM sleep and better deep sleep. And I know my ring will tell me on the days that I take melatonin, I typically have deeper sleep. That's only if, though, I also haven't had alcohol. I wasn't too stressed out during the day. I had the right kind of activity, and I balanced all that other stuff, so it will help. someone mentioned, Donald mentioned melatonin and trazodone and still can't sleep. Okay, so there could be a lot of other stuff going on there, Don, with that, and you definitely want to make sure you're not that you're hitting all the other points too in terms of exercise, activity, and caffeine intake and meditation and those other things too. What was I going to say? I was on melatonin. Oh, sleep aids. So there's some, obviously there's, pharmacological sleep aids, there's more over-the-counter sleep aids, and those typically don't actually make us go to sleep, they just more knock us unconscious. So let's talk about the difference between that. There's a difference between being unconscious and being asleep. I mean, if someone walked up to you and hit you over the head with a baseball bat, you'd be unconscious, but you're not sleeping. You don't go into the sleep stages. And we know that pretty much all of the pharmacological aids, they don't actually help us get into those stages really well. Now, I'm not saying that you shouldn't take them if you're under care and your medical doctor is prescribing it. However, don't use that as a long-term option. You've got to find some other ways to get out of that. So Becky asked, what milligram of melatonin do you recommend? I would start with, what are the dosages that you can pick them up at like a health food store, even just like 1 or 2 milligrams to start with that. And there are some people that take higher dosages, but start with a really low amount and then kind of dose up a little bit and again measure how well you sleep with that. Now, I wouldn't recommend that if you haven't taken melatonin or you haven't used any of the other sleep aids, that you just start with that. I'm a big believer, again, that you understand how complex the sleep is and that you have something to monitor your sleep before you start taking sleep aids. So purchase or look into investing in like the Oura Ring or something like that will actually start to measure your sleep so you have a better understanding of what you actually need more of, and then you can start in with dosing with a little bit of melatonin or some other of the natural aids or things like that. So I don't know if I had anything else. I know I wanted to talk about the sleep aids because this is actually our last slide, and I hadn't talked about that, and I think that was it. Do we have any other questions on sleep? Anything you want me to revisit? It is 1:40 now, so we're good on time. I know I probably went a little faster than I should have in some of that stuff because it was pretty deep stuff, but I wanted to make sure I got to the tips because I know that's why all of you came here. Not all of you, maybe a lot of you were wondering about some different tips for better sleep. And as Kate is saying, anyone is welcome to email me at this email address, drdouglasgordon@gmail. You can also contact us through our website, or feel free to give us a call or stop by. I love talking about sleep. I think it's super critical, and I think a lot of medical doctors now, they are prescribing sleep. They will say, you know what, you need 7 hours a night, you need 8 hours a night. That's the most important thing for you, particularly if you have any of those health conditions we talked about. If you're struggling with weight, if you're struggling with autoimmune issues, rheumatoid, arthritis, lupus, certainly diabetes, things like that. Get on your sleep. Invest into that first. I think nutrition is probably the most important thing we can all do for ourselves. I think sleep is 1A and 1B with nutrition though, and having a better understanding of that. I'd rather that people never exercised, but they always got good sleep, as opposed to exercising more and sacrificing their sleep. We can't sacrifice sleep. We can't, like I said, you can't make that up again down the road. It's not going to be something you can add or bank on the weekends. So once you lose it, it's gone. So make the most of what you got. So so what is the email address that we can send it? Oh, so Kate, they're wondering about the email address to get the presentation again. Any other questions? I'm going to hang out for a little bit here. Feel free to put them on the chat. Shoot me a personal email anytime. Be happy to help. And thanks for coming, everyone.
Thank you very much, and everybody, thank Dr. Gordon for helping us get more insight on sleep and the importance of it. I really enjoyed it, and I like the part about more sleep rather than exercise, but I'm not going to use that as an out. Anyways, thanks everybody for joining us, and like I said, if there are any things that you want to see presented, be sure to let us know. We're here for you guys, and so we want to know. Thank you.